Hello everyone. In today's lecture, we are going to focus on anxiety disorders, another central topic in abnormal psychology. Here is the outline for this lecture. And let's begin by asking a simple but important question. What is anxiety? Anxiety can be described as a state of restlessness and unease. It often involves heightened tension and lack of stability, even when there is no clear danger. In psychology, we understand anxiety as an internal response to vague, uncertain, or unknown threat. It is useful here to compare anxiety with related terms. Fear is an external and direct response to a specific, identifiable threat, something that we can see or name. Worry, on the other hand, refers to the negative thoughts, images, or emotions about potential future events, things that might or might not happen. Anxiety lies somewhere in between, with both physical and psychological tension, but often without a clear focus. On the right side of the slide, you can see the range of disorders that fall under the category of anxiety disorders. Each of these has unique characteristics, but they all share the core elements of excessive and persistent anxiety. Now that we know what anxiety is, let's make an important distinction between normal anxiety and anxiety disorders. Feeling anxious itself is not necessarily good or bad. In fact, a moderate level of anxiety is actually adaptive. It helps us prepare and avoid danger. For example, many of us feel anxious before an exam. This natural anxiety motivates us to study and prepare, which is a healthy and useful response. But when anxiety becomes excessive in frequency, intensity, or duration, it becomes pathological. This means that anxiety may arise even when there is a little or no real threat, or that worry persists far beyond what is reasonable. When anxiety is excessive to the point that it interferes with daily functioning and problem solving, we call it an anxiety disorder. This graph shows the difference between a normal fluctuation in mood and the pattern seen in anxiety disorders. The blue line represents typical changes in mood that most people experience. Even when stress increases, most people are able to recover and return to their normal baseline. But the red line shows that happens in individuals with an anxiety disorder. Their mood drops more sharply and they struggle to recover. Instead of returning to normal, they stay stuck in a cycle of persistent anxiety. This illustrates why anxiety disorders are so impairing. It's not just about feeling nervous, it's about losing the ability to bounce back. Next, let's move on to separate anxiety. Here are some of the key features. First, separation anxiety is characterized by excessive fear or anxiety about being away from home or from attachment figures such as parents. Second, when separated, children may feel lonely, sad, socially withdrawn, or may even have difficulty concentrating on play or school tasks. Third, a persistent fear of harm coming to themselves or family members is common. For example, children might worry about accident, kidnappers, or even plane crashes. Finally, one of the most significant consequences is school refusal, which often leads to academic difficulties and problems with social development. So, overall, the disorder reflects an intense and developmentally inappropriate fear of separation that interfere with daily functioning. Now let's move on to the causes and risk factors of separation anxiety disorder. Psychological factors are generally considered to play a larger role than genetic ones. In other words, while biology may set the stage, it is often life experiences that trigger separation anxiety. For example, stressful events such as the death of a relative or pet, moving to a new place, parental divorce, or immigration can all act as triggers. These experiences often create uncertainty and fear of loss, which heightens anxiety. In young adults, separation anxiety may also appear when they leave home, starting date, or taken on role of parents themselves. These transitions can reawaken early fears of being left alone or abandoned. One influential perspective comes from John Bowlby's attachment theory. He suggested that repeated separation or the perception of abandonment from important attachment figures leads to heightened anxiety and maladaptive responses. Now, let's turn to the support and intervention strategies for separation anxiety disorder. As we saw earlier, symptoms such as school refusal, nightmares, headaches, and stomachs often make daily life very difficult. This means therapeutic intervention is clearly needed. For adults, cognitive behavioral therapy is often the main approach. It focuses on recognizing anxious thoughts, reducing avoiding behaviors, and building coping strategies. For children, play therapy is frequently used. It provides a safe environment where children can express their fears while at the same time strengthening cooperation and communication between the child and their parents. Finally, family involvement is absolutely crucial. Parents are often coached in real time, learning how to respond appropriately to their child's anxiety. This not only reduces symptoms but also fosters healthier family dynamics. So, overall, while separation anxiety disorder can be very challenging, these therapeutic approaches give us important tools to support recovery and resilience. Next, we'll move on to selective mutism. Selective mutism is characterized by children speaking normally in familiar settings, such as at home, but remaining silent in specific social situations. This pattern is what gives the disorder its name. It is often accompanied by extreme shyness, fear of embarrassing situations, or social withdrawal. Children may also display behaviors such as clinging to their parents, refusing to go to school, and temper tantrums, or even oppositional behaviors. Selective mutism is influenced by several causes and risk factors. It is linked to traits such as negative affectivity, behavioral inhibition, parental withdrawal, and social isolation. Parental overprotection and controlling behavior can reinforce mutism, making it harder for the child to overcome silence. In addition, limited peer interaction may result in social difficulties such as peer rejection. For intervention, cognitive behavior approaches are often applied, focusing on reducing anxiety and encouraging verbal expression in social context. Behavior techniques, including gradual exposure to anxiety-provoking situations and reinforced speech through methods such as shaping, stimulus fading, and contingency management. Now, let's move on to the next type of anxiety disorder, specific phobia. Specific phobia is characterized by intense fear and anxiety that are restricted to specific object or situation. What makes it clinically significant is that the fear is excessive and disproportionate compared to normal temporary anxiety reactions. People with specific phobia will often go out of their way to avoid the feared object or situation, or endure it only with overwhelming fear and distress. In children, this anxiety can be expressed through crying, tantrum, freezing, clinging, or refusing to engage it at all. And while specific phobia often begins in childhood, it can actually occur at any age. Now, let's look at the causes and risk factors for specific phobia. First, there are biological factors. Genetic predisposition and biological vulnerability can contribute to the development of phobia. From a psychoanalytic perspective, phobia can be understood as anxiety displaced onto external object or situation, which are perceived as safer to fear than the underlying conflict. Learning theory, particularly classical conditioning, also play a role. A neutral stimulus can become a phobic trigger if it has been paired with traumatic or aversive experiences. Finally, prepared learning highlights an evolutionary perspective. Humans are biologically more likely to quickly develop phobia of certain stimuli, such as snakes, spider, water, or enclosed spaces, because these posed survival threats in our evolutionary past. Finally, let's talk about support and intervention for specific phobias. First, it's important to note that medication is generally not considered highly effective in treating specific phobia. Unlike other anxiety disorders, medication alone rarely provides long-term benefits. The most effective treatment is exposure therapy. This involves gradual and repeated exposure to the feared object or situation, either in real life or through guided imagery. Over time, this helps individuals reduce their fear response and regain control in situations they previously avoided. Now let's move on to social anxiety disorder. Social anxiety disorder is characterized by a strong fear of negative evaluation in social situations. Unlike occasional nervousness, this anxiety appears constantly and can significantly interfere with daily life. Many individuals experience anticipatory anxiety, which often leads them to avoid social setting altogether. Cognitive bias also plays a role. Patients tend to overestimate negative outcomes in social interactions. It is worth noting that social anxiety disorder shows a higher prevalence in adolescents and is more common among females. Now, let's look at the causes and risk factors of social anxiety disorder. First, behavioral inhibition and traits such as shyness and introversion are linked to a higher risk. Negative social experiences or classical conditioning can also lead to learned patterns of avoidance. From a biological perspective, hyperactivity of amygdala contributes to heightened sensitivity to negative emotions. Another important factor is the intolerance of uncertainty. People who struggle with unpredictability are more prone to anxiety. Finally, cognitive theories emphasize that biased thinking patterns, such as overestimating threats, play a key role in maintaining social anxiety. Now, let's talk about the support and intervention strategies for social anxiety disorder. Medication, such as antidepressants, including MAOI, SSRIs, and sometimes benzodiazepines, may be used, though benzodiazepines are less common due to the risk of dependence. Exposure therapy is one of the most effective approaches where patients are gradually exposed to feared social situations until their anxiety decreases. Cognitive restructuring helps challenging automatic negative thoughts such as no one is interested in me by asking, is it really true? Lastly, social skill training such as role playing, assertiveness training, and practicing can be particularly useful for children and adolescents dealing with social anxiety. Now we move on to panic disorder. Key features of panic disorder include recurrent and unexpected panic attack. These are sudden surges of intense fear or discomfort that peak within minutes. Importantly, panic attacks can occur even without identifiable triggers, sometimes during rest or even sleep. The frequency and intensity vary greatly from occasional episodes to several times per week, and in some cases, they may persist for years. Patients often fear losing control or think they are going crazy, and they constantly worry about future attack. Additionally, concerns about being judged or embarrassed by others frequently accompany these experiences. Causes and risk factors of panic disorder involve multiple dimensions. From a temperamental perspective, traits like behavior inhibition, high neuroticism, and heightened anxiety sensitivity play an important role. Environmental factors include childhood abuse, smoking, interpersonal stress, substance use, physical illness, or the loss of a loved one, all of which can increase vulnerability. On the biological level, dysregulation of neurotransmitters, for example, norepinephrine, contribute to the development of panic symptoms. Finally, the cognitive theory explains panic disorder as a misinterpretation of bodily sensations. For example, interpretation palpitations as a heart attack, hyperventilation and overreaction to physiological changes amplify the fear response. Anticipatory anxiety, the fear of future attack, further maintain the cycle. And the heightened anxiety sensitivity leads individuals to exaggerate bodily sensation, reinforcing their perception of danger. Support and intervention for panic disorder involve biological as well as psychological approaches. On the biological side, antidepressants such as SSRI, MAOI, and sometimes benzodiazepines are used. These medications help regulate neurotransmitters like norepinephrine, which play a role in panic symptoms. In behavioral treatment, one key technique is interoceptive exposure. Here, patients are intentionally exposed to internal sensation like rapid heartbeat or hyperventilation in order to induce small mini panic experiences. Over time, this leads to habituation and reduces fear responses. Finally, we have panic control treatment, which is one of the most effective approaches. It focuses on reducing both panic attacks and avoidance behaviors. Patients learn about panic symptoms, practice controlling breathing, and engage in cognitive restructuring to correct misinterpretations of bodily sensation. Exposure to feared situation or bodily cues help build tolerance and decrease avoidance, leading to long-term improvement. Now, let's move on to the next type of anxiety disorder, agoraphobia. Agoraphobia is characterized by fear and anxiety in situations where escape might be difficult or help may not be available. Typical settings include public transportation such as buses, trains, or planes, as well as markets, bridges, shopping malls, theater, or other crowded or open spaces. Individuals often fear experiencing panic-like symptoms in these settings, believing that escape would be hard. From a psychological perspective, temperamental factors like behavior inhibition, high neuroticism, and anxiety sensitivity increase the risk. Environmental influences such as childhood adversity, loss of a parent, or growing up in an overprotective or unhealthy family environment can also contribute to the development of agoraphobia. Support and intervention for agoraphobia mainly focus on reducing avoidance and building coping skills. Exposure therapy is the most effective method, involving gradual and repeated exposure to feared situations, such as public transportation or crowded places. Cognitive behavior therapy helps individuals restructure maladaptive thoughts, for example, changing I can't escape into I can cope with this. Relaxation and breathing training are also important as they provide techniques to manage panic-like symptoms. Medications such as SSRIs or short-term benzodiazepines can help reduce anxiety. Finally, social and coping skill training enhances self-efficacy and builds confidence in daily activities, making it easier for individuals to re-engage with their environment. Now, let's move on to generalized anxiety disorder. Generalized anxiety disorder is characterized by excessive and disproportionate worry that goes beyond the actual impact of events. People with generalized anxiety disorder often struggle to control their worries, making it difficult to concentrate on daily tasks. For example, they may constantly worry about work, health, finances, or even minor daily issues like being late to an appointment. These worries are severe, persistent, and often occur without clear triggers. The disorder is more common in women than in men, and age-related differences exist. Adolescents usually worry about school performance, while older adults tend to worry more about family well-being and physical health. Now, let's look at the causes and risk factors of generalized anxiety disorder. First, biological factors play an important role. Neurotransmitters imbalances such as GABA dysfunction can interfere with the brain's ability to regulate anxiety. Additionally, abnormality in brain circuit, including the prefrontal cortex, amygdala, and other parts of the limbic system, contribute to heightened anxiety responses. Second, temperamental and genetic factors are also significant. Individuals with behavior inhibition, negative affectivity, and high neuroticism are more vulnerable. Further, a strong tendency to avoid harmful or uncertain situations increases the risk of developing generalized anxiety disorder. In addition to biological and genetic factors, psychological and environmental influences also play an important role in generalized anxiety disorder. From a psychoanalytic perspective, unresolved unconscious conflict or excessive parental control can increase vulnerability to anxiety. Cognitive theories provide another explanation, emphasizing dysfunctional thinking patterns in meta-worry or worrying about worrying, intolerance of uncertainty, and avoidance behavior. While avoidance may provide short-term relief, it actually maintains long-term anxiety. Environmental stressors further contribute to the risk. Childhood trauma such as separation, abuse, or loss can leave a lasting impact. In adulthood, ongoing stress related to family, work, or health can also exacerbate anxiety symptoms. When it comes to support and intervention for generalized anxiety disorder, there are three main approaches. First, pharmacological treatment. Historically, benzodiazepines have been used since the 1950s. However, due to concerns about dependency, SSRI and SNRI are now more commonly prescribed as safer alternatives. Second, psychological treatment. Relaxation training help individuals reduce muscle tensions and physiological arousal. Biofeedback is another technique where people use physiological signals such as heart rate or muscle activity to gain better control over their bodily responses. Finally, innovative approaches are emerging. For example, virtual reality exposure therapy uses VR techniques to stimulate anxiety-provoking situations. This allows for controlled exposure to adjustable intensity duration, and frequency, making it a promising tool for treatment. In this session, we explored various types of anxiety disorder. I hope this gave you a clearer understanding of anxiety disorder and their treatment. Thank you for your time and attention.